Modakafusp alfa, or MODA, is an anti-CD38 interferon fusion protein that targets interferon signaling to CD38 expressing cells, including both myeloma plasma cells and cells in the innate and adaptive immune system, including T cells and NK cells. So MODA, we think, has a dual mechanism of action, both targeting interferon to myeloma cells where it's toxic to the cells, and targeting it to immune cells where it can be stimulatory, inducing both myeloma cell death and an anti-myeloma immune response in the bone marrow microenvironment. We enrolled 100 patients in total to a phase 1 trial of MODA in relapsed refractory multiple myeloma, including 50-some in dose escalation and additional patients in dose expansion. And at this year's meeting, we presented the results of all of those patients together. A very refractory population. Almost all the patients had received a prior CD38 monoclonal antibody. Many had received prior BCMA-targeted therapies, and about 3/4 were triple-class refractory and penta-exposed. And in that population, what we saw is an overall manageable side effect profile with anemia and especially neutropenia and thrombocytopenia, but the hematologic toxicities were generally manageable and overall improved after the first couple of cycles, as well as about 1/3 of the patient having infusion-related reactions, but none of the typical constitutional and neuropsychiatric effects that we would expect to see with interferon alpha therapy. And we were really excited that at what we think is the phase 2 dose, 1.5 milligrams per kilogram IV every 4 weeks, our overall response rate was 43%. And that was almost exactly the same in the group of patients who were refractory to prior CD38-directed antibodies, where the response rate was 39%. And while the response rate in BCMA-exposed patients was lower at 27%, conversely, the response rate in the BCMA-naive population was actually 60%, which was a less heavily pretreated population. And we think that compares really favorably to other immunologically active therapies that have been tested in BCMA-naive populations, including teclistamab that was just approved. So we're really excited about the potential for MODA. The trial is now moving into a phase 2 cohort, comparing 2 different doses, essentially fixed dose equivalents of the 1.5 milligrams per kilogram, which was the dose we just looked at, and a double dose of 3 milligrams per kilogram, which was the maximum tolerated dose that we found in the phase 1 study. And this large trial, we're hoping, will serve as a registration trial and hope that this leads to MODA becoming a treatment option for our patients.